So we're now going to move to our next speaker. Our next speaker is Florence Waller, and she is from England, UK. She works as a private carer for an elderly couple, but has worked for agencies, so care agencies, as well as in care home setting over the last 12 years. In January, having spoken about the necessity for same-sex care at a Let Women Speak event in Newcastle, she was assaulted by a trans rights activist. She's going to talk to us today and tell us about the necessity of single-sex care and the steady encroachment of blurred language and how it's affected the care industry. So Florence, thank you so much for coming and sharing what you know. This is a really crucial area, and to get your insight into what's happening will be really great. So tell us a bit about what's been happening and how you found out about it.
I used to work for agencies, and it's only in the past 5 or so years that I've been working privately. And I stayed in touch with someone that I knew who I cared for, who still relies on home care from an agency. And she was telling me what was happening and saying that they keep sending this bloke around to her house. And she's as many people are, she's a very private person. Even with women doing her intimate care, she tries very hard to keep her dignity. She finds it really, really difficult to receive that care. It's not easy for her. So just hearing that they've been sending a man round was really shocking to me. She luckily has her husband at home, and he was able to help her on the days that this man was sent round, and they could just send him away. And also she's about 15 years older than me, and she used to be a carer herself, so she knows what her rights are and she's able to advocate for herself. And this got me thinking, well, how many ladies on that, vulnerable elderly ladies with dementia are on that same route, and are having a man letting themselves into their home, and they can't speak out about it, and do their families know that this is happening? So that's really what started me thinking about it. And this was about 4 years ago. But when I worked for the company that used to look after this lady I'm talking about, there were no males on the books at all. So I was wondering where have all these men come from all of a sudden? And also, now that I work this elderly couple, the lady that I'm looking after is sadly dying of lung cancer, and she's currently bedridden. And the NHS have coordinated a continuing care team provided by an outside provider to come in 4 times a day to assist with her care, because it's quite a lot for just me. And I've also got her husband to look after. So they come in, and they've sent, on no less than 10 occasions, they've been sending a man. So suddenly this problem I knew about, I was seeing it in the flesh and seeing what it did to a whole family. And it was really distressing. It not only really upset the lady I look after, but also her husband became really aggravated in defense of her. He's got COPD. So when he was trying to say, this is, I don't know, the umpteenth time you sent someone around, we said not to do this, he was getting increasingly frustrated. He's also got vascular dementia, which carries with it behavioural difficulties. So he got himself so worked up that he was unable to breathe properly.
I was an au pair for a while, and I thought I was reasonably good as an au pair in Belgium, and I was learning French, but I really put my heart and soul into it. So I was looking after 2 kids, and I looked after them and helped them with their homework, took them for cycle rides, built a pond for them in their back garden, and engaged. And then I noticed, I mean, this was years ago, but there was some male au pairs And I remember talking to one who was in a similar situation to me. He was looking after 2 kids. And I said, oh, what do you do in the day? And he said, oh, it's really good. The parents are out, so I don't have to do anything. And I don't look after the kids. I just carry on playing on my PlayStation. And I don't make them do their homework. And they just get their own food. And he basically just didn't engage with them. And I was so horrified and he felt like he could get away with it because the parents didn't really find out. And so I know that not all men are necessarily going to be irresponsible, but I'm thinking the more in today's culture where they have this position of just get what you can, and it's often to do with learnt masculinity, I can imagine care standards will go down and no one will know.
We don't know exactly what's happening behind closed doors because these are individuals' homes. So you don't have the CQC coming down on a care home looking at what's going on. You've got people with severe late stages dementia relying on home care, and we don't necessarily know what's happened. But what we do know was that within 3 months in 2018, there was nearly 1,000 allegations of sexual assault and incidents reported to the Health Watchdog. This is regarding care, 47 of which were rapes. So this is and this is just what's reported and what we do know. So introducing more males into the domiciliary care workforce is a strange move, given that there is evidence that this is going on. So people are already not safe, and I don't see how it would make people feel much safer. And I have sort of had a cursory look at some numbers, which has been quite difficult to find, actually, believe it or not. But government statistics show that 84% of carers across the sector in England were women, and this was in 2012, with 16% being men. And that number has already risen reasonably significantly, given that we've got a associate care system. I would say it's a juggernaut. It's not really a system; it's a complement, isn't it? But we've got a juggernaut which is really under a lot of strain. So with major staffing shortages. So by 2018, I can't get any more recent numbers than that, I'm afraid. The number of men has risen by 2% in the care workforce. So there's not enough staff as it is, but then they're bringing in more men. Now this is a problem because with an aging population and women having a longer life expectancy, there are an increasing number of females needing care. So it's a huge imbalance of the amount of women who are needing care. So we should have a workforce which is predominantly female to cater for for the females needing care. However, I have noticing with my own eyes there are so many. I see them in their uniforms. Men there's a care home round the corner, or I see them on their bicycles, and I recognise the uniforms because I used to work for these, and it's men, and I was just thinking, where have they come from? So a little bit of digging I realised that there's 2 things that I found interesting. 2012 is the time that figure has raised from 2012 to 2018 by 2%, which is quite a lot, I think. The 2012 was when they brought in the universal credit sanctions. So there's always care jobs. We know that they're understaffed. So universal credit sanctions have come up. So in North Shields, where I live, there's often high levels of unemployment, and there's not many jobs going around, but there's always care jobs. And then there's sanctions if you're not taking jobs that are available. And lo and behold, I'm seeing more men in care. So that's one thing that's, I think, is interesting. But also having a little look on, there was a website called Co-Produce Care. And this was on their website on October 2022. And there's been a massive recruitment drive, which I'd noticed online, for bringing more males into care, when I've just stated that I don't believe that we need more males in care. Really, if male customers, well, vulnerable males need male carers, then the male should be going to them, not to vulnerable women. Anyways, so this website, this is quoting from Nicola Dunn, who's a senior recruitment and retention advisor for Devon County Council. She says, what we found is that men have been particularly difficult to place in domiciliary care. Providers may not have enough hours for men, so they have to try and prepare runs that there are enough service users who are happy to accept a male care worker. She goes on to say, it is quite difficult for us because we have been promoting all sorts of roles to attract all sorts of people in our promotional videos, and photos include men. But when we get the application, it's hard to place them. So
it's just amazing, isn't it? So it looks like they're going to change. So if they call them women, we can't say no to it.
Yeah, I think that's probably going to be creeping in. So so it's clear to me that there's little demand amongst those who require the care for the male carers, yet there's an increased promotion for male recruitment, which is really another folly in the name of EDI, isn't it? The website, however, interprets this very differently from me, of course, and it insists and highlights that there's a wider need to properly identify the further barriers to driving men into social care, and they call to dismantle gender stereotypes to bring more men into the workforce. But as I've said, there's more women needing care, and we're understaffed. So I don't believe that there should be a drive for more men in care. And I was wondering, why is this the big drive to have I've made a mistake, more men in care? Why is there a big drive to have more men in care? There's this big ideological drive to increase the male workforce, and it's partly the gender thing, but also the men are a really valuable commodity. They always have been in workforces because they don't have babies, and they often don't carry the burden of childcare responsibilities. So they're much more flexible with their hours, and they can work longer hours. And if you've got more people needing care and you're struggling to fill care provider roles, then you've got a man who can go and work all day, doesn't have to pick the kids up from school. He's not going to say no to more hours. And you've got a woman who is going to have to say, who might want to say yes, but can't.
In the 1980s, I worked in London for an organisation, Women's Moves. It was a removal company for women. Being a feminist, I thought, I'll do that and stay fit. And anyway, the woman who owns it was a nurse. I think she'd been a lesbian, and then she started going out with this young man, very strong, fit young man. And then she said she'd sent him on a few jobs because Women's Moves, and it was people would phone up and ask for women removers. And we would be meant to be going along. And then she found, and she explained it to me, she said, you know what, Jo, I've just found I make much more money when I send my boyfriend out because he's stronger and he's prepared to go the extra mile, etc., etc. So then what we had to do when we picked up the women, we'd say, yes, Women's Moves, would you mind if a man comes? And then we had to try and persuade them to let the man come. So thinking, that's what's happening now, isn't it? That they can make more money. I mean, I know there's all the other reasons for them doing this, but if they can make so much more money in some cases off men, they're going to try to manipulate us. That sounds, it's horrifying.
Yeah, and I think actually worse than that, worse than manipulate, say, other carers like me. They're manipulating and they're betraying the individuals who are so vulnerable and are actually requiring this care. The CQC has 5 principles of care. Are they safe? Are they effective? Are they caring? Are they responsive to people's needs, and are they well led? Well, I would argue that sending a man would not cover many of those. Are they safe? No, I don't think it's safe. Are they effective? It's not effective if women are not consenting to care from men. Are they caring? Well, absolutely not. It's not caring. It's going against what a woman wants with their regards to their dignity and respect. Are they responsive to people's needs? No, it's completely disregarding a woman's needs. Are they well led? No, because if they were well led, these men would be sent to male clients who need the care. So they've gone against all of their 5 core principles of CQC. The CQC also has a number of regulations which you have to comply with. The one that comes up most is Regulation 10, regards to dignity and respect. So this is to go into the thing we were saying about, the creeping language of gender. So our Regulation 10, dignity and respect, the guidance on the CQC website says, when providing intimate or personal care, the provider must make every reasonable effort to make sure that they respect preferences about who delivers their care and treatment, such as requesting staff of a specified gender/sex. So yes, first of all, I'll just address make every reasonable effort. Now, in my opinion, there's no reasonable excuse not to provide women-only care in a home care setting. I understand that CQC covers the NHS as well, so you can see why it says it's reasonable, because if you've got an NHS consultant doctor of such and such, you may only have 2 or 3 in the country of that particular specialism, and it might not be reasonable to expect it to be someone of the same sex. And in that case, you would have to explore how you can come up, maybe have a chaperone or.
Yeah. So because they quite often have people coming in, if you've got a male doctor and you're a woman, a nurse comes in just to check that's what's going on, which I think is great. And you should be allowed to have that, but I guess they can't have that in home care. If
we look at the statistics again, which I know they've got more men in care now, so currently the most recent statistics that I could find would suggest that there's 82% of the domiciliary care workforce is women. So to my mind, maybe I'm stupid, but there should be no reasonable excuse not to provide for those women who have specified, which will be a large amount of women, I'm sure. Some maybe won't mind, but a large amount of women would specify single sex care. And it should be like the norm. They shouldn't even have to specify it. It should just be, okay, well, you're in your own home. Someone needs the key to your house, just so you feel most comfortable with your care and safe. We're not going to send a man round. However, there's, several men on our books and we'll send the man to them. Surely that makes sense.
Yeah. And what about campaigning against it? Is there other groups, you're against it, but are the groups of care workers organised, and is there a pushback against all of this?
Not really. I think not. I think that the pushback comes from the people requiring the care. There has been a few cases which have been so you might be aware of the likes of Henrietta Freeman. She speaks very well on Twitter about why she requires single-sex care. There was a family who wanted some respite care for their daughter. I think they took it to court actually, and they couldn't get female-only care for a young daughter who needed all aspects of intimate care being performed. So they couldn't go on their holidays for any respite. And people who are unofficial carers, they need respite. They really do. So the pushback is coming from the vulnerable people needing care and their advocates, their family advocates, rather than really amongst the caring community. As far as I'm aware, I'm quite an introvert, so I'm not. I absorb information that I see, but I'm not normally someone who joins in very much. So I'm not myself aware. So there may be, and if there are, maybe people can let me know, and that would be great. But one of the so to carry on from this particular part of the Regulation 10, dignity and respect. So I've covered the every reasonable effort. It goes on to say, they respect preferences about who delivers their care and treatments, such as requesting staff of a specified sex/gender. Now, that's interesting, of course, because many care websites, when they are relating back to the CQC regulations, they have left off the sex and just left it at gender. So they just leave it with that ambiguous term, gender. But the regulation states gender/sex, and within that's in the guidance, but within the regulation, that is pertaining to the Equality Act 2010. So as we know, gender as a protected characteristic, it has to be gender reassignment. So the word, just using the word gender on your website to talk about how you're covering Regulation 10 is too ambiguous. Again, it's another reason we really need to get a good clarification in the Equality Act. But more than that, they're deliberately, I think it's a deliberate move to leave off the important word sex, because how many of these men who are the old-fashioned men not wearing wigs or frocks, who are going around to people's homes, how many of them have had a gender reassignment? How many men who do wear frocks and say they're women have had a gender reassignment? I think we're talking very, very small numbers there. So I think it's deliberately ambiguous. When talking about the guidance and how we talk about people who use the service and need care, they call them service users. And I think that's very telling. It's just very dehumanizing. So if you're calling somebody who requires support a service user, it really shows how little they are valued. I mean, the notion of Regulation 9, which is person-centered care, to me, just by calling someone a service user, you've gone against that straight away. I really can't stand it. These are people we're talking about, not users. If you have somebody that you love who is dependent on home care or care in any setting, please find out what the policies are from the care home or the service provider, and please find out who is coming to their homes and when, because you may need to advocate for them. And you can say, if it goes against their consent, they haven't consented to it, if a man provides care, that is assault, and that will scare them, because that's what I had to do. You have to give them the willies, scare them. The Regulation 9 is person-centered care. So it's supposed to be person-centered care, which is based on the needs and assessments of needs and preferences of the individual requiring the care. Now, if you're not getting this and you're being sent a man, for example, apparently they can't prosecute on this. They can just give the care companies a slap on the wrist. However, importantly, there is a Regulation 11, which is the need for consent, which the CQC can prosecute. So, you know, if you are having problems, like I said before, you know, you have to highlight the fact that it's no consent, that's assault, and make sure you say that to any service providers, because otherwise they'll keep sending a man out to you, because it's no skin off their nose to just get looked at by the CQC. They're just a regulatory body. All they'll get is told, oh, you need to improve, or something like that. But if you highlight the issue of consent and that you do not consent, then that's a criminal issue. So yeah, just know your rights as best you can, because we've not got a lot. We need to cling on to it. I had been meaning to write to, I've just been a bit full on at the minute with work, but I want to write to any dementia charities about that recent NHS Confederation guidance that suggested that dementia patients ought to be challenged regarding gender identity. So if anybody is listening and is interested in this, maybe we could come up with like a crib letter, and other people could use it to try and send out letters to dementia charities. I'd be really interested to know what they've got to say about this, because that goes completely against anything I've ever done in dementia training, to challenge dementia patients. You just don't do it.